Minister, I will say that you don't care. Because a government that did care would actually listen to what the ESRI says and says we need 1,000 more beds now. The Department of Health have a plan for those beds. The problem is that government made a decision, of which you're part of, not to fund those beds. There's no way you can slice that up or dice it or spin it around. You made a conscious decision not to fund the additional beds. And then you say nobody should be on a trolley for 100 hours. The reality is, in many of these hospitals, the bed capacity is simply not there, and you are making conscious decisions not to allow the department who've gone out to tender to actually ensure that these beds are in our hospitals in the future. So you can't have it both ways, because this rests on your shoulders. You've missed your targets in terms of trolleys. You've missed your targets in terms of waiting lists. You're blocking the funding for the additional beds the department wants to deliver. That is the reality of it. Professor Conor Deasy, not Sinn Féin, is saying that this is costing lives. Other professors are telling us that our hospitals are running at 300% capacity. On your watch, your hospital in your county is running an ad, and you tell us that you're doing everything. You're not. What we need is a multi-annual plan. What we need is your government to allow the Department of Health to actually fund those beds that are needed. What we need is your government to lift the recruitment embargo to ensure that the staff that are needed in our hospitals are actually recruited. That's a government that cares.